Hello and welcome to all of our attendees today. This is Techcyte's Pioneers in Digital Pathology webinar series, episode 19, and today we are going to be talking about AI and digital pathology, why it's here to help and not replace you. My name is Troy Bankett. I'm Techcyte's VP of Marketing, and I've been with the company since 2017, and we are privileged today to be joined by Tiffany Chen, who's a leader in digital and computational pathology. She holds a medical degree from Mayo Clinic, Alex School of Medicine, and a master's in global medicine from USC. Tiffany actually completed her anatomic pathology residency at Brigham and Women's Hospital and an NIH NCI postdoctoral fellowship in computational pathology at Harvard Medical School and Mass General Brigham. Before she joined Techcyte, Dr. Chen led digital pathology initiatives at a cancer pharmaceutical company driving advancements in AI-powered diagnostics. And he is our Chief Medical Officer. For our webinar today, we're going to be covering a short intro in who we are as Techcyte, and then I'm going to give the mic over to Tiffany, who's going to talk about, first of all, the buzz versus the fear, and then talk about AI in medicine and in pathology, and go into a lot of detail on what labs are really experiencing today. At the end, we will have a Q&A session, so if you have questions, please feel free via the chat to send them to us. We will then address as many of them as we can during the webinar when she's done with her presentation. So just a short little bit about Techcyte. Techcyte today we're one of the leading providers of AI-powered digital diagnostics for anatomic and clinical pathology. Human health is at the core of what we do, and our technology also supports veterinary and environmental testing. In fact, our veterinary partnership with Zoetis played a pivotal role in demonstrating the strength and scalability of our platform. Today, our AI is used in thousands of veterinary clinics worldwide, processing millions of samples each year. And this success not only validated the technology, also accelerated our ability to deliver robust, scalable solutions for our human medicine, our core vertical. Across all of our verticals, Techcyte's platform brings together AI, workflow tools, and a wide range of scanner integrations. We now serve more than 7,000 customers in over 40 countries, supporting more than 5 million AI-powered analyses to date. Our mission is to positively impact human, animal, and environmental health by becoming the preferred digital pathology and diagnostics platform worldwide. In the US, we're currently RUO only. In Europe, our platform is CE marked, and all of that information is also available on our website, which we would encourage you to look at. So without further ado, I'd like to turn the mic over to Tiffany to further our discussion today.
Awesome. Thank you so much, Troy. And we think this topic is a very timely topic as we see more and more AI being implemented within hospitals and labs today. So there's really no denying that AI generates a lot of headlines and a lot of emotions as well. So on one hand, we see a lot of buzz and excitement. We see AI as a next big innovation in medicine aimed to transform lives. And on the other hand, we see fear, especially amongst lab professionals and pathologists who are worried that AI may negatively impact their lives. So the key question is, what's real and what's hype? So these Reddit posts perfectly capture what we're hearing from rising pathology professionals. We hear questions like, what's the likelihood of DigPath reducing histology job opportunities? Or should lab professionals be concerned about AI? Or if groups can send slides out for digital sign-out, why would they even hire new pathologists? And people want to know if there is a viable career in pathology. And these aren't just, frivolous concerns. These are smart individuals who are worried about their futures. And honestly, they have every right to ask these types of questions. And these aren't just concerns by rising professionals on social media. They've actually been captured in formal studies of current lab staff and professionals and pathologists. So surveys have really highlighted this tension. So for example, this is a lab medicine study that had over 1,700 responses with staff ranging from technologists to medical directors. And we saw that their perceptions varied widely. The top concerns were job loss at 27%, being unsure about AI capabilities at 25%, and security, so typically security concerns over patient data and patient safety. There was another survey that was conducted that had 351 respondents across different pathology specialties that showed very similar divides. So this perception of clinical lab staff regarding AI studies showed that job loss was also a top concern here at 15.6%, as well as security concerns at 23.4% to be among the top issues. And again, these are valid fears, but we're here today to show you the reality of AI in medicine can be quite different and can help hopefully dispel some of these fears you may have. So let's ground this discussion in reality. So AI isn't a futuristic dream anymore. It's already deeply embedded in hospitals and labs. So AI is already everywhere in medicine, and we've seen it across different specialties in the lab. So from blood bank cross-matching to transplant pathology, which I'll speak on a little bit today, to even culture plate reading in microbiology. It's being used right now in the lab. As for hospitals, AI is being used to improve diagnostics in radiology and ophthalmology by analyzing medical images, predicting patient outcomes and risks, optimizing day-to-day hospital operations like patient scheduling and patient flow, automating administrative tasks like billing, enhancing patient care through virtual assistants, chatbots. We've seen a lot of that in the last few months. Remote monitoring, and also assisting with clinical decision support to improve efficiency and accuracy. So let's look at some real-world data on AI adoption. So according to a report by Docus.ai, 80% of hospitals today now use AI in some sort of way to enhance patient care, to help streamline operations and workflow. SQ Magazine found that around 65 to 73% of US hospitals use AI predictive models that are now integrated into the electronic health record, or the EHR. And the AMA says that there's been a significant jump in AI usage amongst physicians. So from 38% in 2023 to 66% in 2024. And we predict that number is only going to increase. And they're using AI for tasks such as documentation and diagnostic support. So these numbers show a clear trend that AI is mainstream now in hospitals and clinical labs. While pathology-specific adoption is still emerging, the barriers are being broken down with the implementation of digital pathology, and the trend is now getting more and more clear that AI is an institutional priority. So hospitals that have adopted AI in their clinical workflow, so like within their clinical decision support or in their EHR, are now looking to adopt it in their lab and diagnostic workflow as well. So within the lab, staffing shortages are growing. So we see this LabCorp report here. And we believe that digital pathology can relieve that burden. So LabCorp's survey shows that a majority of labs have started to or plan to implement digital pathology in the next few years. And most expect AI to transform lab management within the next 3 to 5 years. And we believe that this is what's going to really help solve the staffing shortage that pathology is facing today. So let's go to the core of these initial fears that I've talked about and talk about what this means for you, the pathologists, the lab staff, and the technologists, basically the professionals who will be doing this work every single day. So let's start with the big one. So this is income and compensation. And let's be honest, we understand that this is a primary concern. So we want to reassure you by saying that when labs become more efficient and can handle higher volumes, that's when they really become more profitable. And as we know, profitable labs are more likely to offer bonuses, approve overtime, give raises, and we've seen this pattern repeatedly within healthcare. AI also creates new technical positions. So using radiology as an example, we've seen PACS administrators and imaging informatics specialists earn significantly more than general techs. And the same thing is happening in pathology. So AI is creating space for technologists to develop new digital skills, like managing scanners, overseeing workflow quality, or working with imaging software. And this makes your role more valuable. For pathologists, AI support allows you to focus on more complex cases and clinical decision-making. And as these skills grow in demand, the people who can really combine this traditional expertise with digital know-how will be well positioned for recognition and over time, stronger compensation. When it comes to turnaround time, let's use a real life example. So this example here is from the Mayo Clinic in the parasitology lab, where they have adopted our parasitology trichome test. So let's look at what has happened to their turnaround times. So we saw that volume increased significantly during the COVID-19 pandemic, and it got to a point where turnaround time ballooned to around 2 weeks. And then when they started implementing our Techcyte solution, they noticed an almost immediate decrease in turnaround times, even though the volumes continue to remain high. So then we know that faster turnaround times in general means happier clinicians, better patient care, and often higher reimbursement rates. So in this case, everyone wins. So when it comes to job security, that's also another big question. Does AI replace staff? And the short answer really is no. So at ARUP, for example, AI is now being used to screen out negatives for the fecal testing, but it doesn't eliminate the need for skilled technologists to confirm these findings. So you see this quote here. This is not, it's meant to reinforce that AI is not here to replace pathologists or lab staff. It simply can't function without your expertise guiding it. What it does is it handles the repetitive work or the repetitive tasks so you can really focus again on the complex decisions, quality oversight, and patient care that only trained professionals can provide. So this is from Dr. Cornish from the University of Colorado, that says there's no new paradigm where you can implement AI and suddenly the AI takes responsibility for all the decisions. We still need a human there. So this means that AI tools are only as good as the humans who can oversee them. And your judgment, again, is essential to catch errors, provide clinical context, and ensure that technology is used safely and responsibly. So this is where we want to address professional value. And we believe that AI can help grow your professional value. When AI takes on the routine, quantitative work, it allows you and frees you to focus on the nuanced, high-value cases that require judgment. And then we have this quote here from Dr. Couturier, and this really emphasizes that, that the slide really underscores why human expertise is truly irreplaceable. Yes, AI can be faster at certain mechanical processes, such as like counting, quantification, or flagging patterns. But what it can't do is provide the judgment, the context, and the verification that comes from being a trained human professional. We also have this quote here from Dr. Bill Maurice from Mayo Clinic. And what he's saying is that our value doesn't go away with AI. It actually grows. And we need to stay at the table to help, guide it to be the most effective in our day-to-day. And it grows because our expertise is what ensures that these tools are being used most safely and effectively for patient care. So AI isn't just about efficiency, it can also reduce burnout. And burnout is one of these topics within medicine and healthcare that has been really at the forefront of discussion. So there's been a study that has showed that over 80% of lab professionals experience some sort of burnout symptoms. So it can be anything from the stress that they feel to more severe depression symptoms. And what they've attributed to these burnout symptoms have been increased workload pressures, unrealistic turnaround times, inefficient workflows, and unmanageable caseloads as major drivers of this burnout. We've also seen happiness studies that show that 35% of pathologists in 2021 felt overworked. And that number is actually increasing. And we saw new studies that show that in 2023, it increased to 41%. And a lot of that was attributed to long work hours as well. So AI has a strong potential to ease burnout by taking over these repetitive tasks and mentally draining tasks. So things such as previewing cases, drafting reports, ordering tests, pulling clinical data. A lot of these require you to, traverse multiple different systems, try to understand ordering workflows, which takes away from the more meaningful and high impact work of actually sitting down and trying to evaluate a patient. So by taking on these repetitive time-consuming tasks of the job, AI can help pathologists feel less overworked and give them more space to focus on the intellectually rewarding cases, hopefully bringing back a sense of purpose and even joy in their work. And we've seen that at the Mayo Clinic. Again, this is within their parasitology lab. And after deployment of our AI solution, they've seen quite a significant increase in performance and staff satisfaction, going from under 50% to over 80%. So when the tools you use every day make your job easier and less stressful, it can completely change how you feel about coming to work. And that's what we're really seeing with AI in pathology. So what we really believe, the key benefits of AI in pathology and in digital pathology, while it's great to reduce burnout and increase patient provider satisfaction, we also believe that it really needs to drive better care. So the ultimate goal is to improve outcomes in our patients. And I'll go through a couple of examples of how our AI has already been shown to drive better patient care in a couple different studies. So the first one, this is a JCM article that found that our stool parasite screening test, AI and scanners were 5-fold more sensitive than manual evaluations, and that AI had a slide level sensitivity of 98.9% and a specificity of 98.1%. To give you some context, let's look at this fecal trichrome slide here. So for technologists, reviewing these can be quite tedious. There's a lot going on the slide. It's time consuming, and scanning the entire slide under the microscope field by field, looking for rare parasites, can be quite difficult, especially if you are on your 20th case of the day or your 6th or 7th hour of the day. So this is where AI really shines. So instead of replacing the technologist, it acts like a guide, can help you highlight regions of interest and point you in the areas that are most likely to contain these objects of interest or parasites. So that means less time spent on repetitive scanning and more time spent on confirming the diagnosis with confidence. And we wanted to emphasize that the result is a faster turnaround, but also can lead to potentially reduced fatigue and higher accuracy. But all in the while, we want to make sure that the technologist is firmly in control of the final call. So another example is at the Mayo Clinic, where they also implemented our AI for stool parasite screening using the trichrome staining solution. So the results were dramatic. So what we saw was AI increased positivity rate to 5%, meaning fewer infections were missed. For negative reviews, this used to take up to 5 minutes, but now we're cut down to 30 seconds. And overall, the lab was able to triple its testing capacity. So this is just a powerful example of how AI can help technologists move through routine cases more quickly while making sure nothing slips through the cracks. At Quest Diagnostics, we saw similar success. So in their study here of our solution, we saw that AI achieved 99% agreement with manual results. And what's really exciting is that the AI also flagged additional positives that weren't caught initially and then were later confirmed by manual microscopy. This means that technology isn't just keeping up with human review. It can help us find cases that might go otherwise undetected. At ARUP, we saw with our wet mount iodine solution that in their study of our AI test with 477 specimens and 26 parasite species, the results showed 100% agreement for 20 species and over 90% for the rest, which is an incredible level of consistency. So what this tells us is that AI really has the potential to handle broad routine screening work reliably and can free staff to focus on the more complex and unusual specimens where human expertise is truly irreplaceable. So moving on to our Gram-Stain solution at the Mayo Clinic, they also ran a study here which showed that AI reduced read times for respiratory smears by 38%. So this just reduced the read time down to 38 seconds, when it was over a minute before. For sterile smears, read times were reduced by 53% from over 2 minutes to about a minute as well. So that kind of time savings doesn't just make a technologist's day easier. It means clinicians could get answers faster and patients can get care sooner, and labs can help manage higher volumes without having to add more staff. So AI isn't only for microbiology. At Mayo, we also looked at chronic lymphocytic leukemia, specifically for fluorescent in situ hybridization testing or FISH testing. So we saw that AI achieved over 88% sensitivity and very close agreement with expert review. So in practice, that means AI can handle object level enumeration, like things like counting nuclei or patterns, and it can really save technologists and pathologists from the most tedious and time consuming parts of the workflow. So we gave some good clinical pathology examples. So I wanted to shift now to our anatomic pathology examples here. So this is within frozen section kidney transplant evaluation. So we ran a study here that tested AI for kidney transplant biopsies. So our AI was able to identify both normal and globally sclerotic glomeruli, which are important in how we evaluate transplant kidneys. And compared to manual review, AI assisted review helped drive concordance with expert renal pathologists by 50%. It also cut review times in half, saving up to 15 minutes per slide. So think about this in the context of organ transplantation, where every single minute matters. There's also a shortage of renal pathologists, which means a lot of general pathologists with limited renal training are now being asked to make these types of evaluations. With AI, we can not only potentially get faster reads, but we can also help general pathologists get to a closer level of expert level accuracy, which means that more kidneys can get evaluated and more lives could be saved. On the cytology front, we do have a Techcyte SureView product, which is our cervical cytology product. It's being used right now for 100% QC at Core Plus in Puerto Rico. So they ran a study that showed that out of more than 1,400 slides, AI helped identify 39 false negatives that had been previously signed out as normal. And that's a significant impact on patient safety. And review times also dropped from nearly 5 minutes per case to under 2 minutes. And that's more than twice as fast, while also helping the reader improve accuracy as well. So across all of these labs, we've seen at Mayo, Quest, ARUP, and Core Plus, the story has been quite consistent. AI saves time, it can increase accuracy, and it could improve staff satisfaction, as we've seen in these studies. And these are real results, and they really show that AI can be a partner and not as a simple replacement for you. So beyond the numbers, what we really find impactful are just hearing what people are saying. So we're hearing that now that our technology, our AI, is able to help detect rare cases that would have otherwise been missed. And we've also heard that new technologists feel more confident in making these decisions, and they feel like AI is guiding them in the right direction, especially when they're doing more intensive shifts like overnight shifts. And we've also heard that for them, that they feel like this is the biggest advancement in screening technology for parasites since the invention of the microscope. And we love hearing this kind of feedback because it's showing us that this isn't just incremental improvement, it has become truly transformational. So to close, AI in digital pathology is not about replacement at all. It's about empowerment. It helps us reduce turnaround times. It could help us increase accuracy, create new roles, ultimately provide better patient care all around. And we believe the key is to stay engaged. And as pathologists and technologists, we must shape how these tools are adopted, ensuring that they enhance our professional value and improve healthcare outcomes. I'll turn this back to Troy now for our Q&A. Thank you.
Tiffany, thank you so much for that excellent presentation. I'm sure everyone watching this got the message that AI truly is here to help us. As promised, we've gotten quite a few questions that we would like to address in a Q&A session. We have the first one by Upneil, sorry if I mispronounced that, who asks, what does validation look like for these AI tools in the laboratory? What level of accuracy is acceptable for some of your image analysis software?
Yes, great question. So how we see it, validation for AI tools in the lab should be no different than how we're evaluating any other diagnostic test or piece of software. So we typically look at metrics like sensitivity, specificity, positive predictive value, negative predictive value, concordance rates, and reproducibility. So those are the types of metrics that we would want to see. And to get those metrics, we would have to run clinical validation studies. And as for what's deemed acceptable, I think that really depends on the clinical context. So for things like high stake tasks, like with transplant pathology, you would want accuracy as close to expert pathologist levels. For screening tools, it could be different than that. So it really depends on, again, the task that's at hand and how exactly these tools are going to be used as decision support systems.
Thanks. Josh has asked, how do I keep my skills sharp when utilizing AI?
Yes, that's a great question too. So for AI, they're not taking away all of your work. So, for example, the studies that we've shown with our parasitology tool. So as a technologist, you are still having to evaluate and confirm the AI. So AI is just guiding you in the right direction. And as you can continue to see where AI is picking up, new positive samples or helping you identify new positive objects, that can also help train you to get those examples as well.
Thanks. Kelly has asked, how can I help my institution understand this type of AI in pathology is different than ChatGPT, et cetera? And I assume they're
Yeah.
referring to large language models.
Yes, definitely. So yeah, we've seen the explosion of ChatGPT and these large language models, like from everything from Google to Microsoft. They all have their own LLM, as we call it. So this is different. So the AI that we're talking about isn't exactly this type of AI where it's a large language model. So a lot of these AIs that we brought up today are based off of a different type of machine learning. I guess, yeah, a different type of methodology. So to help your institutions understand where these fit in is to really show them the proof there in the studies. So the studies, we can really see real life examples of, accuracy being increased, turnaround times being decreased, and patient and provider satisfaction also being increased as well. So looking at those real life examples can really help drive these conversations with your institutions.
Thanks. JRM has asked, what are the parameters that are included as AI?
So again, AI is a very, very broad term. And I was trying to touch on that earlier in that last question, that there's lots of different methodologies in AI, and all of these will have their own parameters. So something that is a large language model, like a chat GPT, will be different than a convolutional neural network, which is like a CNN, which is what a lot of these other AI tests that I talked about today are based off of. And it just really depends on what is being used for this test.
We've got one. Brian asked, how much training is needed before staff can confidently use AI tools?
Yes, that's a great question. So we want to make sure that when AI tests are being deployed in your day-to-day workflow, there's not like a steep learning curve, because that kind of takes away from the whole purpose of implementing a new tool to help you with your workflow. So these tools are designed to be seamlessly fit into your workflow. And what we found with trialing out our AI tests at different labs and different studies is that adoption has been pretty quick. It's pretty easy. So once you're comfortable with evaluating slides on the digital setting, the AI workflow is pretty easy to adopt as well.
Thanks. And we've got two questions. I'll group them into one. Julie asked, what happens when AI disagrees with a technologist's or pathologist's interpretation? And then Alec asked, are patients comfortable knowing the AI helped review their results? So kind of both angles there.
Yeah. So the thing about AI is that it's here to assist. So the tech, the pathologists, they still sit in the driver's seat. So they're the ones who ultimately have to make that call at the end. So if they don't agree with the AI, or the AI doesn't agree with them, it's up to the pathologist now to decide what's best for the patient. So we're not taking the decision making out of the hands of the pathologist or the tech. They're the ones who still get to make sure that the diagnosis that reaches the patient is one that they're comfortable with. As for patients feeling more and more comfortable with AI being used to help them generate their results, we believe a lot of that comes from education and really things like this webinar and other types of media that can help patients and everyday people understand that AI is not is no longer this gigantic, black box where you don't understand, or we don't really see like how this is going to really change patient care. So if we can have more education out there about AI and workflows, AI and results, and making patients feel confident that the AI results that they're getting aren't going to be inferior to manual results, we believe that patients will be able to adopt and feel more comfortable with their results being derived by AI assistance.
Indeed. Thank you so much. Our time is up for today. Any other questions we can address directly offline. And this being said, I would like to thank all of you for the time that you've spent with us today. Please reach out to our sales team if you have any other questions. And everyone who has attended today's webinar will also receive the video recording that they can review at your own ease. Thank you, everyone. Until next time. Bye-bye.
Thank you.